Hi, my name's Jim Martelo. I am a licensed health insurance advisor. I work primarily with small business owners, independent contractors, real estate agents, folks who are getting health insurance on their own. And I wanted to share this video with you that I had on a Zoom meeting today with a group of real estate agents here in Florida. And I'm sharing it because I go into some detail that's going to be helpful for you to understand health insurance and the differences of coverage, protection, and budget, and how they can be optimized to give you the most for your money. A lot of folks really never take time to truly understand their health plans, and that's really where I try to make a difference by giving you many options, explaining them to you, and then optimizing what you're paying for the best level of coverage for your needs. So please watch the video to learn more about health coverage and stay in touch with me if I can ever help you. I'm always available at 813-394-7925. You can also go to my website landing page at getaffordablehealthcoverage.com. If you just want to leave your name and phone number, I'll be in touch. But again, nice to connect with you. Thanks for watching the video. Stay well and stay connected. I realize that people can get health coverage from a lot of options, but what I really try to distinguish myself is also the personal service. I'm available to people 7 days a week, and it makes a difference when you need it. And also explaining to you the plans. So I am part of a large organization under, it's called an IMO, Insurance Marketing Organization. It's the Healthcare Solutions Team. There's 3,000 brokers like myself as part of this organization. And through that relationship, it gives me access to really the top carriers for health coverage, dental coverage, vision coverage, supplementary. I do life insurance, Medicare supplement. I literally can offer plans for everyone. And so that's the ability that I have by being licensed. And I'm also very knowledgeable about all the plans and put them together. So this is me and my family. I mean, I'm live in Tampa. We been married now, it'll be 37 years, have two wonderful daughters. So a little bit about me and what motivates me. You can also find me on LinkedIn, and it's Jim Martelo spelled with one L. A lot of times people spell it with two L's, but it's with one L. But let's, kind of think about this little slide for a second. I believe that a lot of people can relate to this. A little bit of humor, but it's true, is, people just getting so frustrated and confused about health coverage. And there's been a lot of changes over the last, especially 10 years with the Affordable Care Act and now the growth in private health insurance. And people really just don't know where to go and where to turn to. And there's a lot of folks like this, and I realize that. And that's where I really try to come in and make a difference in focusing really on three primary areas. It's about coverage, it's about protection, and it's about your budget, affordability, and it's understanding it. And I offer plans that can kind of lean more towards more coverage or more protection, or definitely the most affordable. I mean, and I'm able to do that through just understanding people's needs and what the plans are able to do, and really be more of an advisor than a salesperson. I really look to be an advisor, and I've grown in my business to be really a full service advisor and broker, available 7 days a week. And my goal was really to get you the best needs for your budget. So I'm good at that. And people stick with me because I'm always available for them for new options and keep them abreast, because there are new plans out there that is really good for you to know. And here in Florida, you've got some of the best options for private health insurance in the country. You really do. So let me just kind of say, I put this in here, this little slide in here, because I know in the busy world of being a real estate agent, time is money. I can relate to that. So for those of you who said, okay, Jim, I get it. I'm interested, but I don't have time. I've got a video at healthcoverage.com. I'm also going to show this slide later because if you want to connect with me, you can certainly call me, but that's a landing page at getaffordablehealthcoverage.com. I've got a video on there and you can get more contact information about me. And it is a landing page, so you can put your name, phone number, and email. And I definitely will be in touch as well. So for those of you who just want to check out now, I just want to leave you with that. But I want to share with you now some education about health coverage. And I theme my discussions with folks really with the saying, it's options based on realities. So know your options. And one of the first places to start is to know your network. And most people have heard the terms HMO and PPO. There's even new networks like exclusive provider organizations. The only kind of plans that we deal with are PPO networks. That's nationwide coverage that allows you to go directly to any kind of doctor. That's really the best kind of network to be in. An HMO is really more of a local area network. They'll control you more. The majority of the ACA plans now use HMOs, and that's why you hear people saying that, they don't get accepted anywhere. So it's been a big reason why the ACA plans haven't been that successful too, is they don't have good networks. So you want to be in good networks that you can go to get network discounts, to get access to the top providers and hospitals nationwide. It's really important. So, know that and know the differences between them. But again, the only kind of networks you're going to find when you work with me will be the PPO networks. And again, the two main advantages, and they're big advantages, is nationwide access and the ability to go directly to any kind of provider, just giving you a lot of flexibility and the best kind of coverage for the cost. So, when you talk about options based on realities on where you can first get your health coverage. So one of the reasons I'm speaking to you is because one of my base of prospects that I try to work with are real estate agents. And for the main reason that most real estate agents are independent contractors, entrepreneurs, much like me. So I work with folks that aren't really getting access to health coverage through an employer in a W-2 environment. I'm dealing with folks, 1099, private business owners, folks who are getting health coverage on their own. But when you think about the options, you really are going to start with your source. So in general, just know, because things can change for people, but your source could be an employer coverage. But then when you get coverage on your own, you're either going to get coverage on the marketplace, an Obama plan, ACA plan. Here in Florida, it's Florida Blue, or you're going to do off-exchange market. And that's what I specialize in private health insurance. A lot of great options. And again, depending on your needs, and I'll talk about that here, right there would tell you which kind of that first direction to go in. Again, options based on realities. So let's talk about some of the advantages of the ACA plans, the Obamacare plans. Number one is they cover pre-existing conditions. And so one of the first things I talk to someone about when we start talking about health coverage is in general what your health is. I mean, if you're diabetic, you're going to really want to be directed more towards an ACA plan for that, especially if you're type 1 and taking insulin. It can get really expensive, although I have plans for folks who have pre-existing conditions. But in general, you're going to find that folks who do have some illnesses, maybe recent cancers, heart attacks, things that are, that have caused some definitely challenges in health, that it might be better to go the Obamacare route. However, one of the negatives of it is it can be very expensive, especially if you are earning over around $50,000 a year, where you're not going to be able to get those subsidies reduced. And even with high deductibles, HMOs, I mean, that's some of the negatives of it as well. But depending on your situation with health would determine really what direction initially to know if the Obamacare, the ACA plans are really your best choice. Now, if you're in good overall health, if you don't have pre-existing conditions, if you're really looking for coverage for helping you going forward for sickness, illness, and injury, I mean, that's the primary area there that these off-exchange plans are going to be best for. But again, part of the negatives of it is that when they say no coverage, I mean, a pre-existing condition varies. There could be certain pre-existing conditions that would disqualify you from even getting on a plan. But then if you have a pre-existing conditions, it's kind of a gray area at times with whether it's going to get covered. But if it's something minor, it's not going to be all that significant considering the much lower premium you'd have versus an ACA plan on it. But an off-exchange plan would have limits of maximum benefit, but I have plans to go up to $5 million. So it's not really a big issue, but it does have limits versus the ACA plans that technically don't have limits on coverage. And the pros of it, though, is that it's definitely affordable. I mean, you're going to find these premiums to be about half of an ACA plan and can be structured with better coverage. I can put together a plan that's going to cover you 100% for critical illness with premiums that would be about half of what you would find on an ACA plan. There's also plans that don't have deductibles. They're indemnity plans, but they're called fixed benefit, zero deductible plans, giving you first dollar coverage. So you have a lot of flexibility in the types of plans. And I'll go into a little bit of detail on the differences here, but I offer them all. And again, all of the plans we deal with are PPO networks, nationwide coverage. So what kind of clients buy what? I've covered this in general, but in general, if someone is in poor health or if their income's kind of, it says here about if you've got like really low income, you're going to be on Medicaid. But there's that area where if you're between like $25,000 and $50,000, you might be able to get some subsidies for an ACA plan to make it very affordable. Could be really good. And on the other hand, too, some people who are very ill and are worried about ongoing care, had major illnesses, that plan could be better for you long term because of the unlimited benefits. However, if you're in good overall health, and if you're making 20 plus 30,000 more a year, if your income can vary, fluctuate, there's a lot more flexibility in the off-exchange plans because the premiums that you pay aren't going to be tied to your income. So if you're an entrepreneur hoping that your business is going to grow, this is also a plan that you're going to be able to be more comfortable with long term, knowing that people won't be looking over your shoulder. So when we talk about the off-exchange plans, again, going down that path, and whether you're looking maybe for more coverage, like first dollar coverage of your hospital and doctor bills, or if you're looking for more protection on plans that would give you a max out-of-pocket protection, a cap, would determine really the types of plans that are going to be best for you. But the more common of the plans, they're called short-term medical. You might see them abbreviated STM, term major medical plans. And they're very more traditional plans that are going to have a deductible, a max out of pocket, but it gives you that cap for protection. They have maximums, usually like $1 million or $2 million, or the sweet ones. If you're concerned about that, there are plans that go up to $5 million of coverage. And through these plans, you're going to get in-network discounts. And also here in Florida, these plans now can be written for up to 3 years of guaranteed coverage. That's huge. Just about 3 years ago, they were 3-month plans. So literally here in Florida, as well as many other states, you can have these plans written for you to get up to 3 years of guaranteed coverage, regardless of what may happen to your health during that time. And I can explain that more in detail, if we talk more. But also, too, we now have what you can get are preferred rates, even lower rates, just by meeting a few other health requirements. You're not going to have to see a doctor. You're not going to have to give blood or anything to get on these plans. It's kind of like an honor system, but it's really questions that you'd be asked, and just be truthful. And again, if you're in good overall health, I can help guide you with the questions, etc. But again, it's a plan that's more traditional with term major medical. But then you have the limited medical plans, also known as indemnity plans, zero deductible, fixed benefit plans. Really very popular plans, no deductible, first dollar coverage. You go to the doctor, you're going to get money paid towards the doctor visit. You get blood work, it's going to pay towards that lab. It may not pay at all, but you're going to have first dollar coverage on the majority of your claims, including hospitalization and surgery. It's like a light switch. You can turn it on, turn off the plans, and they're extremely affordable as well. One of the more popular ones that I offer here in Florida is with United Healthcare on the limited medical plans. I write a lot of them, and people like them. And they do not have term limits. They just can continue. Very flexible. So again, the differences between them, really I've covered. Term major medical is going to give you more protection because it's going to give you that max out-of-pocket cap. I can also blend in it, and I'll explain all this to you, how we can blend in supplements that could be used to cover larger claims related to accidents or critical illnesses, God forbid, cancer, heart attack, strokes, where you're going to have a larger claim where the concern of a plan with a high deductible, let's say a $10,000 deductible, and the potential of a $10,000 upfront bill if you have a big medical bill, that's where supplementary coverage can come in. And that's where my skill and knowledge of these products, I can help to optimize it, literally to help to build a plan that's really not all that expensive in considering the other options that would be available to you that can cover you 100%. That would cover you 100% in the event if you had something real serious happen. So a lot of flexibility on these plans. So let me share with you, when I work with people, it really is a matter of just kind of getting to know each other and establishing that relationship. And through that, I can get a good idea of what could be the best plans that you're looking for. And again, it's really that spectrum of coverage and protection. And between the two plans, I mean, it can help to optimize them towards your budget. And that's what I'm able to do. But if we go through that process where, I'll talk to you on the phone, we'll identify your needs, I will send you out specific plan information. And I got a great app that I can send it out with. And then with the different options, you're able to even go and open up the brochures if that's something that you want to get into the nitty-gritty. But I certainly understand people's need and willingness to understand these plans. And you'd be surprised. There are folks that get involved with health coverage that don't really know what they've gotten into. And that's not really a good situation to be in because it could be too late if something serious were to happen. So just do a review of what you have, what you need, and I really can help guide you in the direction that's going to optimize, again, coverage, protection, and budget. So if we can find a plan that you like, we check doctors, your budget, you're ready on a start date, then the application can get submitted and get approved. Not everybody can get approved for these plans, but I've tried to lay out some of the basic guidelines of the direction that I would recommend you move with the types of plans. And the submittal and the administrative part of it is something that I do really well to make sure that you get into the system. Cards will get mailed out to you. You'll be in communication with me. And I really am committed towards being in touch with people literally 7 days a week. It's just part of the business, the way that I operate. So that is me. It's Jim Martelo, health insurance advisor. My contact numbers, any of those numbers work, but the best number, if you want one number, 813-394-7925. That's my cell number. You can call or text me at that number anytime. I am licensed here in Florida. I have access to a lot of great carriers. I understand the differences. I also do dental and vision, and we have some great plans for that as well. So again, if you just want to see me and learn more about me, I've got a video that if you go to affortablehealthcoverage.com. It's a landing page. I got a video there. You can see me more. And then there is even a, if you just scroll down a little bit on that landing page where you can put your name, email, and phone number, and you'll get some emails from me. But if anything, you know, I'll know that you're interested, or just call me. I'm always available, and I truly can help you with your health coverage needs. So I just want to thank you all for attending this webinar. I've got a good amount of people here, so I hope that it will make a difference. And again, that's me, Jim Martelo. I will just say to you, don't overpay for health coverage. You don't have to, but let me help you understand the plans that you're in, and see if I can help you in a better situation for health coverage. So I'm going to end it here because I don't think there are any questions, but I certainly look forward to staying in contact with everyone. Have a blessed day, everybody. Bye-bye.